whether we like it or not, forced to think about a digital world, about using data and digital technologies with which we can actually look at various aspects of our lives. And I think healthcare is certainly one of them. The way I look at it is that, look, we've been talking about universal healthcare for a long time. We've been talking about the fact that India is underinvested in healthcare and that we don't have enough resources to really meet these daunting challenges that we have in a country like ours, where we are so short of doctors. We are short of 1 million doctors, 2 million nurses, and another million paramedics, and so on and so forth. So I think, we've always talked about bridging these deficits with technology, but the big question is how. And I think now is the time for us to seriously think about how do we deliver access and affordable healthcare for every citizen in our country. Now, I think Healthathon can really come up with some really cool ideas, and I really look forward to the prize winners. And also not just the prize winners, but those that come up with all these wonderful new ideas, which can actually generate a number of entrepreneurial possibilities. So let me start with this whole aspect of, a digital healthcare system. It all starts with data. And as you know, unorganized data is absolutely useless. So we need to structure it, we need to analyze it, and we need to interpret it for it to become valuable knowledge. And that's where we start with that health ID. That's the first kind of a digital, data point that we need to start a database. And what is that health ID? That health ID is a number and a docket in which you will collect all the digital data throughout your life's journey. That's the intention, that all your health data can be collected in this one digital wallet, if you were, of health. Now, of course, and when you think about the National Digital Health Mission, which is now going to be a game changer for the way we look at delivering healthcare, I think the National Digital Health Mission is going to look at multiple aspects of healthcare. One is, it starts with the health ID, and I'm really pleased to note that over a lakh of people have already created their own health IDs. But then it also requires this health ID to be capturing data and then sharing that data with consent. And that's what this health stack is all about. We very, very effectively delivered financial digital inclusion through a digital financial stack, which has created the unified payment interface, which allows you to basically, have a digital wallet, which allows you to freely interface with various payment mechanisms. And the concept is very much the same. How do we create a health interface? How do we create that platform where health data can be shared with various stakeholders? So the first stakeholder is the patient or the citizen himself or herself. And if it's my data, I want to own that data. And then I want to be in a position to share that data with who and when I please. And therefore, since we already have a data system of financial data sharing, which really works on the OTP mechanism, we should actually use a lot of these kind of interfaces, which people are getting used to and which people find it easy to do. So I think consent-based health data sharing is going to be very important. And why is health data sharing important? Because it is interoperable. It can be accessed by multiple people who need to see that data. So whether it's your treating doctor, whether it's your consulting doctor, whether it's a referral doctor, your data becomes omnipresent in that sense. Today, we have to physically take all our data file, the files of our, diagnostic data, our health records. We take it physically from doctor to doctor, from hospital to hospital. All that can stop. It can all be on a cloud. and a doctor or anyone from anywhere can actually access it, provided you give consent. So this is the first starting point of creating that digital architecture for health. But then, when you think about the National Digital Health Mission, I think there are five key pillars of which we have to look at. And every one of them has a technology element to it. The first is, of course, about how are we going to finance all of this. So the financing model is going to be extremely important in terms of delivering on affordable healthcare. And there are various ways of working on these financing models. And that will require, again, a technology interface with your national digital database. The second thing is about the governance. Today there is a lot of concerns around abuse and overuse of medical systems and medical treatments, and we need to have a governance mechanism that can actually regulate all of that. Now, the governance mechanism is very important when it comes to data because, as I said, there is data privacy issues, there is data sharing with consent issues. There is also this whole issue about how do you deal with the private sector and the public sector and how they deal with patient care and how they deal with the financial, reimbursements and expectations from patients. So I think that also requires a digital, sort of governance mechanism to make sure there isn't all this happening. Even today, we are very, very concerned about the amount of leakage that happens in healthcare systems in the government. And because of the digital backbone, you can make that very transparent and extremely accountable. So I think that's the next aspect. The third aspect is human resource. We need to really look at how are we going to deal with human resource. Telemedicine, telehealth, all this can actually come into effect with technology. And then, of course, you've got the whole citizens engagement aspect, which is about how do you connect with the citizen? How do you create the pull from citizens for a technology? And to put this into perspective, I thought I'd use an analogy of vaccination. I mean, today we're all so focused on the arrival of the COVID-19 vaccine. So let's start looking at how are we going to deploy vaccination at speed and scale across India. It's a daunting challenge. Why is it daunting? Because of multiple reasons. Let's start with the vaccine itself. It's not one vaccine. You're going to have multiple vaccines. And these vaccines are going to come at different times. They're going to be staggered depending on regulatory approvals. Let's start with the arrival of the first approved vaccine in India. All these vaccines are going to come under this, what they call emergency use authorization, because this is an evolving space. Because of COVID-19, the regulators have actually thought that it's better to start with a emergency use approval, and then as and when we get data, we will give it final approval. So we have to contend with the fact that you're going to get multiple vaccines. Each vaccine will have its own immunogenic profile. Some vaccines require 2 doses, some vaccines require 1 dose, some vaccines require an adjuvant. It's very complex, okay? And although India is very fortunate that it has had an extremely brilliant track record in terms of deploying the polio vaccine across the country, the big difference is that the polio vaccine was an oral vaccine. It could be administered by just trained ASHA workers or A&M workers, and it was done over several years. Today, the challenge is very different. The challenge is that we have to deploy this vaccine at scale and within a very short period of time. Within 3 to 6 months, we have to basically plan at least to vaccinate the entire nation. And then we have to do it in a way that allows us to use these multiple vaccines and track and trace every single individual who is receiving this vaccine to make sure that they've received that 2 shots if it is required, and to see whether at some stage, if they find that it doesn't protect you beyond about 6 to 9 months, then and if some other vaccines protect you for over a year, then who are those who received it for the shorter durability of response, and who are those that received it for a longer duration of response. So this kind of data that you need to capture is not going to be easy without technology. And therefore, I believe that you must have a very comprehensive database for vaccination. And if you actually do this very efficiently, believe me, this is your foundation for an excellent digital healthcare system in the country. And this is what will allow you to deliver on universal healthcare in a very, very advanced way. So let's start with this concept that you will create this database. How are you going to create the database? According to me, the easiest way to do it is to link it with Aadhaar. Aadhaar today is the most uh, universal number that we have in our country. And although, there's a lot of concerns about overusing Aadhaar and stepping into the privacy issues, surely no one is going to be worried about privacy of vaccination. Why would I be worried about my vaccination data being surreptitiously accessed? I wouldn't worry, because I mean, for anyone to know that they are vaccinated, nobody wants to hide it. So let's look at Aadhaar as the linker. Aadhaar is the most well-established number, and it is available to the largest number of people in our population. So let's not waste that resource. And linking your vaccination data with Aadhaar, believe me, is going to be a very, very comprehensive database which can easily be accessed if in the future you need to find out who are those people who got vaccinated by vaccine A and who are those that got vaccinated with vaccine B, because the profiles ended up being different. The data that you generated a year later or 2 years later seems to indicate that there's a big difference between these two vaccines. Now comes the logistics. Now we know that this vaccine requires cold chain logistics, and it requires refrigerated storage conditions, because it requires 2 vaccinations. Now, to do all of this, you will need to have a very efficient supply chain, and again, technology can play a great role in making sure that you have it all worked out for taking this vaccine to the deepest rural heartland in our country, because that's where the problems are going to be. So we need to make sure that you use technology to track and trace. When you send out a vaccine from an urban center to the remotest village, you should be able to track the cold chain truck that is delivering it to that hospital or PHC. That's the kind of sophisticated technology that you will need. And I think digital technologies can definitely help us in this. Then comes the human resource. Like I said, the polio vaccine was an oral vaccine. This is an intramuscular injection. So you will need hundreds of thousands of nurses and doctors to deploy these vaccines across the country. Now, how is that going to be possible? I think you will need to use MBBS medical students and nurses to do all of this. And in order to make sure that they are delivering those vaccines properly, some amount of training is going to be required. But this training can be very easily given on a mobile phone training digital app or a digital training methodology to show everyone how they need to deliver these vaccines. So technology again will be a very, very important intervention in training human resource to deliver these vaccines at speed and scale. Okay. And then of course comes the whole citizens engagement aspect, where again you will need medical messaging and even a helpline to answer people's questions on the vaccines, how safe they are, how they should be delivered, and how it is important for people not to just take one shot, but 2 shots if it is required after a month, and why they need to be compliant, etc., etc. So in all of this, you can see the importance of technology and digital, health. So now let's come to the whole aspect of the universal digital health system that we are talking about. Today, we know that telehealth and telemedicine and teleconsulting, the digi doctor as it is called, can easily actually bridge a huge deficit that we have in the number of medical professionals. But I think it's very important to ask whether the villager in Bihar is going to accept a digital doctor, or do they still want to see Dr. Sahib in their hospital or the primary health center? So, therefore, we need to look at technologies that can actually connect people to digital technologies in a way that creates a pull from the people, not a push. Because the moment you get into a push, it is never going to be that effective. The moment people says, no, no, I want this digital doctor to tell me why am I not feeling well today, that is when it shows that your technology is working. So this is what digital healthcare is going to be all about. And then, of course, for a country like India, when you talk about access and affordability, this is an opportunity for creating a democratic, level playing field for people to access healthcare. So let's look at digital data now. Diagnostics, early diagnosis is going to be very important to basically have better outcomes, to even prevent diseases. And a focus on wellness is also going to be very important. So all these aspects of healthcare should can be digitally delivered. Now, when you look at diagnostic data and health ID records on which they are captured, I think the whole availability of digital data is going to be very important, because this digital data has to be extensively analyzed for multiple things. One is for healthcare planning, one is to assess the disease burden in the country, and the third is how to basically lower the disease burden rates. So whether it's infectious diseases or whether it is non-communicable diseases, I think digital data is going to be very, very valuable. I just want to share with you that under our CSR program at Biocon, we have started what we call as Ilaj clinics, which are digital primary health centers where we capture health data and we analyze it real time to see what is the disease burden in that area. And we are actually mapping out things like cardiovascular or hypertensive disease, respiratory disease, of course, diabetes and anemia. These are some of the things that we are tracking in these centers and seeing what is the disease burden and how should we intervene, how should we make sure that people are getting the right treatment, etc., etc. And then you have all these armies of ASHA workers who can actually be your digital assistants, because people need that interface and they can provide that. So just like you had your business correspondents in the financial inclusion system, I think ASHA workers can be your digital assistants when it comes to your digital health requirements. And they can be your very powerful interface in terms of helping you get a healthcare service, helping you get a connect with the doctors, with the in a triaging case, how do you get them into a hospital or to a nursing home or to a primary care center? These are the things that you can do very effectively using ASHA workers. You need a career plan for ASHA workers to really get them up a career path that really makes better and better use of their skills. So according to me, digital healthcare is going to be the most exciting space for young entrepreneurs, for startups. And I really wish every one of you all the very best in terms of the Ideathon and the Hackathon, because these are times when we need to be flooded with new ideas. And when you look at digital healthcare, it cannot be a migration from the physical world to a digital world. It ought to make you do much more. And I think the digital world and this whole digital healthcare database that we are trying to create can be one which will be very transparent, very accountable, very trackable and traceable. And therefore, I believe that this is a very exciting time for India and we must not lose this opportunity. Let's leapfrog. Let's use digital technologies in healthcare in a way that will transform healthcare in our country. So I will end there and I'll say thank you very much. And if there is any time for question and answers, I'll be very happy to take a few.
Wow, thank you so much, Kiran, for that extremely inspiring, informative, and lucid keynote address. I would like to actually echo one of your quotes from earlier in your career when you spoke about how you achieved success in Biocon. You said that I did it with nothing but lots of common sense, hard work, and courage. And I think that's exactly the need of the hour here, which is that as India, we need to know what our capabilities and strengths are. We don't have the most money in the world. We're not the richest country, but we can be the smartest country. And with the talent that we have here, I'm sure that we can live up to that. And I'm sure the hackathon participants and ideathon participants are really inspired by what you said. So, guys, if you have, if you did agree with what Kiran said, please do show your appreciation through the emojis in the bottom bar. And I believe we have time for 2 or 3 questions until 3:40. So, if someone has questions, you can put them in the questions, preferably in the questions tab. Um, Okay, there's one from Vamsi, which is more about timeline for implementation. But guys, we'll come to that in the next talk. The next talk we have is by our iSpirit volunteer Siddharth Shetty, talking about an overview of the national health stack and personal health record system. So you can save questions on that for him, please. I think for Kiran, if you have more high-level questions or questions about her viewpoint at larger issues or maybe her own journey, I think that would be most illuminating for everyone to hear about. So there's one interesting question, Kiran, where Muhammad asks, is exclusion inevitable given the digital divide?
Well, that's what you should. It's a very good question because that's a question we should ask ourselves in terms of when we design our digital backbone. How are we going to make sure that actual focus is not the urban, the ones who have the digital literacy and the digital access? It is the rural that needs to be your focus. So if you can design everything with the rural folk in mind, the rural infrastructure in mind, then you will have that inclusion and you won't have that exclusion. In fact, even in the vaccine case, I think that's a very important question. How do you make equitable access to the vaccine happen? That is going to be the challenge. So if it's very good to, it's very easy to roll out the vaccines in urban India because you have the hospitals, you have the doctors, you have the nurses, you have all that is required, the cold chain, the refrigeration, and everything that you need. So it is going to happen that, the urban populations will have easier access to the vaccine and they'll have the first access to the vaccines. But what about the rural people? Now you have to make sure that they also get equitable access. It's much harder, but that's the challenge. And I think if we can rise to that challenge, then I think we will be very successful in addressing that equity.
Absolutely. Makes a lot of sense. And I would actually like to add here that we have an event coming up next week on Sunday, the details for which we'll be sharing with everybody over Slack and Twitter. But that event is called Healthcare Realities from the Ground. And in it, we have a panel discussion featuring several healthcare workers and doctors from areas like Dantewada and Chhattisgarh or Himachal, basically very remote regions. And the thought process there is that by understanding the problems on ground, we'll be able to build for everyone rather than just building for the top 100 million or top 30 million Indians.
Yeah. So I would like most of those efforts, even in your hackathon, if they can really think of the remotest village in Bihar or Orissa or anywhere in the country and imagine themselves to be one of those poor, marginalized people who need access to healthcare. That will come up with the best idea and the best solution, I feel.
Definitely. So there's a lot of questions here. Unfortunately, guys, we can't answer all of them. Kiran, I'm very mindful of your time. You have an extremely busy schedule, and you've already given us so much of your time. So I'm not sure if we can take another question or whether
one more, then I'll have to go.
Okay, sure. So I don't really know how to pick one from the 15 questions that are showing up here. So if I don't choose your question, then apologies. But somebody, Ronak from from Bajaj Finserv Health has asked, when you started Biocon, the whole biotech industry needed transformation in terms of not just new industries, but the clinical ecosystem. So any learnings there that can be applicable to the transformation that will now have to happen to the entire medical ecosystem through digitization?
So let me answer that question by saying when I started Biocon, there was no biotech sector. So I had to start it and shape it, and I had to do a lot of things that weren't there. So that's why it took so long to basically build my company. But today, if I look at it, yes, I think we need to create a very important infrastructure, which is about research and development. I think the focus on original research and innovation has to be there. And as a country, we have the potential, but we haven't had the ecosystem. So we need to do that. So I know as an entrepreneur, I have actually invested in innovation in a big way. But it's been very, very difficult to really innovate in a country like India because we don't have all that it takes to innovate new drugs in India. Because we need to build that credibility. And I've been trying to do that for a long, long time. And I do believe that in the next 5 or 10 years, we will finally start seeing the green shoots of being able to do that in India. Because we have to, as you rightly said, you need that whole clinical research environment in India, which is missing. So today, even when we do clinical trials, there's a lot of suspicion and concerns around how you did those clinical trials, and people, the credibility is lacking. So you need to build that credibility, even though we have everything that it takes to build that credibility.
I'm sure, Kiran, that the direction which you helped us chart will eventually see us build local industries, for research, manufacturing, things like that. But in the interim, what we're hoping will happen through initiatives like the National Health Stack is that we create these
Absolutely. I think the health stack is a brilliant initiative. I think starting with that health ID is very important, and making people aware of the power of of digital technologies to deliver on that universal healthcare agenda is going to be very important. And I really wish you all the best. I'm really excited that you've initiated that you're having this event, and I really look forward to some of those good ideas and the hackathons that you're going to be engaging on over the next few days. So all the best, Aryaman. Thank you so much.
Thank you, Kiran. I'm sure our audience is really inspired. I feel it. And, if you're building for this competition, maybe Kiran will see your projects, because you be uploading them online. So, people will be looking out at what you build. So please think big, dream big, and give another round of applause, please, for Kiran. Thank you so much. We are honored to have you. We'll
Thank
be back in just a couple of moments, guys, with our next talk by Siddharth Shetty with an overview of the National Health Stack and PHR system. But once again, thank you, Kiran.